Thank you very much.
Yeah.
All right, so yes, I'm Dr. Renee Christensen. I am a chiropractor and I own Active Family Chiropractic. It is a private practice in Rim Mountain. Give you a little bit of my background first, as Tim already gave you some of it. I'm a West alumni, graduated from here in 1993. I did my undergraduate degree at University of Wisconsin-La Crosse and finished up at UW-Stevens Point. I had a bachelor's degree in biology and chemistry. And then after my bachelor's degree, went for my doctorate at Life University, College of Chiropractic in Marietta, Georgia. And then after my doctorate, I did a postdoctorate degree, which is a DICCP, stands for Diplomat in Clinical Chiropractic Pediatrics. It's an additional 3 years that I chose to do for prenatal, postnatal, and pediatric care. So I'm not sure how many of you are familiar with chiropractic, so I just want to give you a little bit of a background first. Chiropractic is a natural form of healthcare. We use spinal adjustments to correct misalignments and restore proper function of the nervous system, which helps your body function properly. So does anybody know what the nervous system does for you in your body? Yeah, it does everything. Absolutely anything you can think of, any bodily function, the nervous system coordinates it. So there's two main parts of our nervous system. Does anybody know what those two main parts are? Great. Yeah, central nervous system is the big one. Your CNS, which consists of your brain and your spinal cord. And then your peripheral nervous system, which is all the spinal nerves that exit out. These are kind of chopped off here, but these will be the peripheral nervous system. So the brain and the spinal cord, which is the central nervous system, obviously pretty important. So our body encased it with bone. We have our skull to protect our brain. And to protect our spinal cord, we have all of these little bones called vertebrae. So the spinal column is what protects our central nervous system, so it's able to function properly. And this will help facilitate the communication between the brain and the body. So basically how our central nervous system works is our brain will send a signal down our spinal cord, out these spinal nerves telling our body to do something. So if I want to reach for my phone, a signal will go down my brain, out the nerves, the muscles to my arm, tells me to reach out, and another signal will tell me to pull it back in. So absolutely everything we do is coordinated through our spine and through our nervous system. So when our spine is out of alignment, our central nervous system doesn't work the way that it's supposed to. So this is where chiropractic comes in. So how do we know if our spine is functioning properly? There's a lot of ways, and I'm going to do a little bit of a demo at the end of the class when I have one of my daughters here to come for an adjustment. But one of the ways that we tell in our office if your spine is functioning properly is by scanning and assessing your nervous system. So there's two scans that we do in our office. One of them is a temperature scan, which takes a nerve root temperature. So basically there's going to be a thermometer that rolls up your spine like this, and right at the nerve root where the nerve comes off of the spinal cord, it'll give us a skin temperature reading. And if you have an increased temperature at a certain spinal level, it'll indicate extra blood flow or irritation at that level.
Do you do that manually, or is it?
It's a computerized scan.
Okay.
Yeah, it's all computerized scan, so it's all objective. And so the second portion of the scan is actually muscle activity. So then our patients sitting on the table, and we have, it's called an SEMG, or surface electromyography. It's electrodes that go down your spine, will go along the spinal column, all the way down in the muscle tissue. And that's what this slide represents. So you can see on the left is when you're in a seated upright position, that's what your spine should look like if your muscles are functioning properly. So the image to the right here, is oftentimes what we see when patients come into our office. Those areas of color are where your spine is not functioning properly. And the color tells us exactly how bad off you are. The white areas are normal, green is mild, increase in muscle activity. Blue is moderate, increase in muscle activity, and red is severe. So any of the areas that show up as abnormal are the areas that we adjust. Yeah. What's black? Black is kind of our off the charts. Yeah, a little bit worse than red.
So in this image right here,
Yes.
where is this person gonna find the discomfort, or where's that gonna affect them the most?
That's a great question. So we have different types of nerves in our body, but certain nerves are pain sensing and certain ones aren't. So unfortunately, you guys have maybe heard the term silent killer, right? Maybe you've heard that referred to it like a heart attack is a silent killer. Well, in the chiropractic world, we refer to what's called a subluxation as the silent killer, because not always does our body give us these signals that something's wrong, which is why we do these scans. Because someone could have a scan like this, not even realize that their muscles aren't functioning like they should, because they don't feel any pain. So if it's not affecting the nerve or the pain portions of these nerves, you might not know you have a problem. So that's why we scan. All right, so I have a little handout for you guys. This is mine. Anyone help him? I hope I made enough. Yeah, so here we go. So this is probably my favorite chiropractic hand motor chart that I use in my office. And again, it goes back to, it shows how your body is controlled, by how your nervous system controls everything in your body. So like for this performance, we go back to the scan, or it's right here, you see C1 is increased in muscle activity as far as being red. So if we look at our chart here at C1, what does C1 control in our body? Blood supply to the head, over the face, skull, brain, nerves, middle ear, sympathetic nervous system. So kids with ear infections, they might see that show up red on their scan. You get a sore throat or losing your voice, probably my scan is going to be a little bit red right now between C1 and C5 because of my vocal cords and my immune system. Yeah, so that's kind of a cool chart that you guys can look at. So why did I become a chiropractor? When I think I was probably about 12 years old, the first time that I received a chiropractic adjustment. Growing up, I had kind of a lot of illnesses, I was always sick, and when I was about 12 is when I started getting plagued with headaches and migraine headaches. So at the time, went and saw an allergist, they thought it was allergies, went and saw a dentist, they thought it was TMJ affecting it. I think I saw a neurologist at one point, and was taking beta blockers as a 12-year-old, saying that was causing the headaches. Nothing really was helping. At the time, my mom was seeing a chiropractor, so he said, why don't you bring your daughter in, let me take a look at her. And went into his office, and he assessed me, and it was the first place that I ever received any relief from the headaches that I was. And I mean, I pretty much take 2 Tylenol with breakfast every day for the headaches. So I started getting adjusted as a 12-year-old, and it was the first place that I ever received relief from my headaches. So then, I was about 12 years old. I was an athlete. In high school, my big sport was gymnastics, so gymnastics is pretty tough on your body. So through my sports, I utilized chiropractic to help enhance performance, increase flexibility, reduce wear and tear to my joints and my spine, and decrease any soreness that came along with the sports that I was performing. The boring stuff now. All right. So you guys, since you are all thinking about going into something in the health field, probably want to know a little bit about education required, correct? Yeah. All right, so in high school, quite honestly, high school for you guys is a lot different than it was when Kurt and Tim and I went to school. I don't even know if we had all these AP classes, did we?
There was a couple.
But not like you guys have now. And, you know, back then I don't even know if it was important. I think that if you had an aptitude or liked the math and the sciences, most of you guys probably have that, and that's why you're going into the medical field. But you're going to be required to have a bachelor's degree, and to practice as a chiropractor, you're also going to need a doctorate degree.
So how many years, I mean, you had your list of the schools, so you
Yeah.
went to 4 years, or 2
4 years of
across.
undergraduate, if you get done in 4 years.
Yeah.
Doctorate program is 4 years as well, so it's 8 years total.
And then how about that other thing?
The postdoctorate was 3 years, but you don't need that, that's just something I chose to do. But there's different, you know, kind of like different medical doctors can specialize in different things. You can choose to specialize in different aspects.
So that school that you went to in Georgia, was that one of the only ones around at that time, or were there many others?
No, there's about 15 actually. I have that on one of my next slides, Tim, let's see. So here we go, these are the accredited chiropractic colleges. So there's about 15 in the United States, and I have them listed out kind of by city and state. And you can see there's not, I went to Life University in Marietta, Georgia. And it's the biggest and largest chiropractic school in the US. There's not, the closest ones around here, you can see down there's Northwestern Health Sciences, which is in Minneapolis. There's also one in Iowa, which I think is on this page. Yep. Palmer College is in Iowa, and then there's one in Chicago. So if you want to stay in the central Wisconsin area, those are your choices, but otherwise you're going to be traveling to a different part of the country for your doctorate degree. And if you really want to travel, there is a part of the chiropractic colleges all over the world. So just do a quick little slide to show how many each country have. So, let's see, what's the next one? All right, so when you're in chiropractic school, in those 4 years, you do a total class hours of 4,485 hours. So this kind of does a breakdown of the education that you're going to receive at chiropractic school. So you kind of see the big ones, the anatomy and biology. This one probably seems a little strange to you guys, the dermatology, right? Eye, ears, nose, and throat, 630. The reason we see, it's very similar to a medical doctor in that we're considered primary care physicians. So, we're in an area where we have very good access to all different types of doctors, chiropractors, medical doctors. But if you practice out in Montana or more rural areas, you might be the only doctor for hundreds of miles away, so you have to have the education and all those things. So, yeah, a little obstetrics, gynecology.
I would have thought chemistry would have been a little higher.
Chemistry? Well, because you get in your undergraduate, because you're coming in with that, it's your prerequisite courses to get into graduate school, are the biology and chemistry. So you fulfill most of your biology and chemistry education in your undergraduate degree. All right, so then once you go through your 4 years, in order to practice chiropractic, you have to pass different parts of the state and national boards. So there are 4 parts of the national boards. So first part you can see is your proficiency in anatomy, spinal anatomy, physiology, chemistry, pathology, and microbiology. Second part of the national boards, you have to be proficient in general diagnosis, neuromusculoskeletal diagnosis, diagnostic imaging, principles of chiropractic, chiropractic practice, and associated clinical sciences. Part 3 is you're starting to work more with the patients in the clinical competency portions. So case histories, physical exams, case management. And then those first 3 parts are all actually written portions that you sit for, much like your SATs or ACT exams that you guys are going to take. And then your part 4 is where you're going to have to work with a patient. So they typically provide subjects or patients for you, and then you get assessed on x-rays, diagnosis, your technique, and your case management. So in the state of Wisconsin, actually it is too. The requirements are different from state to state. In the state of Wisconsin, you're just required to, once you pass all 4 parts, you have to obtain a certain score, and then you have to pass a jurisprudence test to practice in the state of Wisconsin. But it's like I'm also licensed in the state of Florida. In the state of Florida, you had to take a 3-day exam that was kind of like that part 4 where you bring a patient and you do 4 different parts. So every state has different requirements to get your license in that state. So that's also something to kind of keep in the back of your mind as well when you're in chiropractic school, because certain states will have different requirements. Like I think it's Ohio required you have 100 venipunctures if you want to practice in the state of Ohio. So I didn't practice there, but I took the class to get the extra venipuncture so that if I ever want to go there, I had it. Right? So you have to kind of have an idea when you're in school where you want to go, because different states might require different things. In Oregon, you had to do different gynecology and proctological. You had to do certain assessments and a certain number of those in order to practice in those states. So
there's no residency type thing, like
yeah.
medical?
So when you're in school, so part of your 4-year program, the last year is while you're finishing up your coursework, is when you're doing your clinical competencies. So the first portion is your student clinicals, where you work on other students in the chiropractic college. And then the second portion is where you're actually, at least where I was in Marietta, Georgia, we had 3 different clinics. throughout Atlanta, and we had patients, they would come in for a reduced rate because we were students working on them, but yeah, they'd come in and we had to work on so many patients, and we had, yeah, you had your attending doctors that assessed, make sure you were doing your x-rays properly, that you were analyzing your x-rays properly, that you were adjusting, helped you put your case management together. Yeah, so we do just like a residency for about a year. Once you graduate with chiropractic, and this is probably where chiropractic is pretty different than a medical doctor or a doctor of osteopathy, is that most of them do private practice or group practices. There's not chiropractors in a hospital setting. So if you, when you're gonna come out with your degree, you're either gonna go be an associate doctor in somebody else's clinic, or you're gonna open your own practice, or go in with a couple of friends and start your own group practice. My work schedule, I personally work about 30 to 40 hours a week. I'd say 3/4 of that work week is with patients, and about a quarter of the time I spend with charting and running the office. Unfortunately, in the last decade, I would say that number's maybe gone up. You know, in documentation and everything you have to do is always takes a little longer than you want it to. You spend a little more time in that than the fun stuff which is with patients. All right, so what I like most about being a chiropractor is getting to know the patients and their families. Like I said, in the state of Wisconsin and most states, we're primary care physicians, so we're different than, you know, I don't want to say we're similar to physical therapists, but when you go to a physical therapist, you see them multiple times over the course of weeks and months, so you get to know them. You know, same thing with the chiropractor. We're getting to know our patients because they're coming in multiple times a week or once a month. I get to treat a variety of patients. Because of my specialty, like I said, I've gone up to the hospital here and I've adjusted patients' babies within the first day that they were born right at the hospital. So I get to see brand new babies all the way through elderly. The other nice thing about chiropractic is that I get to see such a variety of things. Headaches, allergies, back and neck pains, ear infections, enuresis, sports injuries. So I'm not just seeing somebody with heart condition all day, every day. I have different things coming in to my office on a daily, weekly basis, so it keeps it interesting. And, oh my daughter's gonna kill me for having that picture up. I should probably change that, right? So that is a few years old, but those are my 4 kids. I have 4 children. And I think I talked about this last time I was here, but I think it's one of the things I didn't think about much while I was going to school is kind of creating that life balance. I knew I was going to go into the health field to some degree, but one of the things that chiropractic allows me to is I set my own schedule. I have 4 really active kids. I get to go to all their sporting events if I want to. It's something to consider because I don't think we always think about that. And the medical field is fantastic, but you're going to be a surgeon, you're going to be on call, and you're working lots and lots of hours, and you're going to miss out on other aspects. So I think it's something to think about when you're choosing your profession for the rest of your life. Cool. So I will open it up now for any questions before my subject gets here to do a little bit of a chiropractic demo. Well, I have a few things to show you too. So do you guys have any questions?
So one thing I noticed more of dealing with being a coach in physical education and health, doing more research and more study and stuff, is that chiropractor is really starting to become more accepted in a lot of, and it always was, but it's really becoming more accepted in like the sports teams. They're realizing if they can come do the alignment along with their therapy.
Right. Well, every NFL team has a chiropractor on staff. So most sports teams, like I said, I see so many athletes in my office because, and I kind of brought this little spinal chart to show you guys, and I can pass these around. You guys can look at them if you want, but maybe I'll just start passing around. So this right here is an example of kind of a textbook normal spinal joint, and you can kind of feel it move. And if I pinch these 2 spinous processes together, you can kind of feel how the spine moves normally. There's different phases that our spine goes through as it degenerates or as we age. So if we have misalignments in our spine that go uncorrected, the spine degenerates more rapidly than it should. So that's what we're looking at here. So if we go to that phase 1, and as you kind of pass them around, you'll see the difference between that and the next one, just how it doesn't move quite as well. So do you feel the difference between first and the second? Yeah. So unfortunately, like any health condition, spinal conditions are progressive in nature. So if you don't correct it when it's in a phase 1, it has a chance to degenerate and get worse. And we see these discs get a little bit thinner and weaker, and those discs maybe bulge, those spinal nerves get pinched off, and now we see even less motion and less function. And again, if we don't correct it when it's in a phase 2, it degenerates even more rapidly, and it has a chance to degenerate into a phase 3. And you guys can just kind of feel the difference of how the spine moves in a normal phase 1, phase 2, or phase 3. All right. Any other questions? No? Have any of you guys been to a chiropractor, or do you know what a chiropractic adjustment looks like? Is that any fun? Yeah.
So,
Oh, yes, yeah. Do you want me to kind of show what I do?
Sure.
Yeah, so I just kind of thought I'd do a little demo of what a chiropractic adjustment looks like, because this is essentially what I do on a day-to-day basis in my office. When a patient comes in, we're gonna, that scan that I showed you with the color, we're gonna, do a case history like when you go to any other doctor, and then we're gonna assess the nervous system and the spine, how we do, and then after I look at all those pieces of information, I put together what I would consider a care plan for a patient. And the main way that I treat patients is adjustments to the spine. So this is my daughter Estella. She's a freshman here at West. So I'm just going to kind of demo what a chiropractic adjustment looks like. So we'll start things now.
characteristics of you, of yourself, physical demands?
Yeah, and that's kind of what I want to show, because essentially I'm on my feet all day. And you can see what I'm going to be doing is pretty physical work. So I could be, I guess, in somewhat shape. I'm not as good a shape as I was 4 kids ago, but yeah, right. So one of the things that I look for on a visit-to-visit basis when I'm checking somebody's spine or adjusting them is a leg length discrepancy. So, you guys probably can't see that from here, but when I look at Estella's feet, her right leg is shorter than her left, and I'm going to bend her up at the knees here, and so I'm going to cross it over to see how it shifts, and it's a little bit lower. So what that is it's a reflex in your body. Kind of like when you shine a light in somebody's eyes, what happens? Pupils constrict, right? It's a reflex, it's a visceral reflex. So this is a reflex that happens in our body. So it's one of the things that one of the tools we can use to check patients. So the technique that I actually use, there's a lot of different techniques out there, but they use different parts of the table that raise up and raise down. There's instruments that some chiropractors use, and I do a little bit of that. But so would that be the table that I would normally use? But then typically what I'll do is I'm going to assess how her spine is moving from the top to the bottom, and I'm feeling for areas of joint restriction or where the joints maybe aren't moving as well as they should.
So do you do that test that gives you that screenout every time?
So we do that on the initial consultation, and then I put together a care plan, and then after we do a series of treatments, usually between 10 and 12, we repeat it to see if we make changes.
So how often should someone come in, let's say you're doing 10 to 12 treatments?
Yeah, it depends how bad it is. Like if I've seen somebody whose scan is red and black and their spine is full of degeneration, we usually start seeing them multiple times a week. If somebody doesn't have a lot of color and they don't have severe symptoms, we only start seeing them once a week. So, okay. So once I find the areas that are moving as well as they should, I'm going to do some adjustments here. So take a deep breath.
One time in college, the scariest thing, I had a bad neck, I still do, but when he cranked my neck and cracked my neck, I'm like, oh, am I going to be able to walk ever? Right? Because he took the neck and just, it's like, oh my goodness.
We're going to do another one here, so you can kind of relax your shoulder. You guys hear those?
I want to try.
Good.
So Stella gets this done on a regular basis.
She does, yeah, Stella gets adjusted all the time. And she's spoiled because she'll come home from basketball and, oh, I fell today or whatever, and she's like, check me in, or rib was up, was it yesterday the rib was up or days ago?
Yesterday.
Oh, you got hit in the ribs, who was it?
Allie.
Allie. Allie hit her in the ribs, so we had to adjust her rib. So,
So Stella, with you
Yeah.
getting this
And
done on
that's
a
it.
regular basis, do you ever get sore after?
she doesn't, yeah, so that's it. So go ahead and have a seat, honey, I'm gonna check your shoulder for them and show me what that looks like. I don't know if it's gonna be out, but I'll check it. So what I'm gonna have you do is I'm gonna have you hold your arms up in front of you like this. So you're gonna try to hold them up, I'm gonna try to push them down. Hold. Okay, hold again. Yeah, so she can't keep her right shoulder up, but she can keep her left one up, you see that? So that usually tells me there's something going on in her upper extremity on the right here, so I'm gonna start here.
Or that I've broken it 3 times.
This one she did break a few times.
She doesn't know how to stop before a wall at the end of a basketball court.
Good. Yes. Or, what was it, the
Soccer goal post.
goal post? There we go, did you hear that? Ooh. And she's got crepitus in her scapula from some of these injuries.
So it looks like you're cranking on it pretty good.
Yeah, pretty good. Arms again. There you go. Yep, I'm sure keep it up.
Renee, do you have a table at home or do you take her into your clinic?
I do have a table at home.
Yeah.
So my family's spoiled, they get adjusted at home.
Yeah.
But yeah.
So what does an average, let's say, come to your clinic for treatment, what's that gonna cost you?
Well,
And how's insurance working?
insurance is, depending on your insurance coverage is great. You know, certain insurances have really good coverage, like anything else, certain insurances don't. So depending on your insurance, a lot of people have 100% coverage or just a minimal copay when they come in. Like I said, in the last 5-10 years, when paperwork has gotten worse, also insurance coverage has got worse. So a lot of insurance plans now have gone to high deductible plans, and so they don't pay out like they used to. So for those patients that have $5,000 deductibles, you're not going to need $5,000 deductible in my office. So we put together time of service or cash plans that are a little bit more affordable than going through your insurance even.
So, length of visit, someone comes in?
Well, as long as it took you to adjust her, yeah. I mean, that first visit, if we're taking x-rays and if we're, when I'm doing that scan, it's usually about 30 to 45 minutes with the patient, but visit to visit is about 5 minutes, depending, yeah, sometimes therapy. I hook Stella up on therapy at the office. We also do, you maybe saw that as part of the national boards, is physical therapy. You're not required to take a physiotherapy board, but again, if you're going to use physical therapy in your office, you have to. So I chose to do the physical therapy board as well, so that I could do physical therapy in my office. And so we do muscle stim, ultrasound, cold laser, yes, traction. So
And I don't recall you having it up there, but typical day as far as how many patients? Depends?
it really, I mean, every doctor is completely different. Yeah. So
What's your ideal day?
It depends on, like for me personally.
What's your ideal number that you would like to see or that you feel
I
comfortable with?
probably, on my busy days, which are Monday, Wednesdays, and Fridays, are probably 35 to 40 patients I'll see in a day. And yeah, so I mean, it's physical. So and on my half days, I kind of keep my Tuesdays and my Thursdays I'm there for half days, and so I maybe I'll see 10 to 15 people today, but I'll do other things. I have other appointments and do other things throughout the day. So
How many other people are working with you?
right now, it's just myself. Yeah, I had another chiropractor. I have associates from time to time, but usually it's just myself. So, oh, and staff. So I have 2 staff. I have somebody that does insurance in my office and somebody that is an assistant that helps put patients on and off of therapy and run the front desk, schedule, reschedule, collect co-pays. You guys are quieter than last year. Any other questions? Yeah.
How does your office work? Like, does someone have to be referred to you or just you?
No, and because we're primary care physicians, there's no referral required. You can just call and make an appointment.
And that's probably why the insurance covers it.
We're primary care. Yeah, so.
whereas a therapist,
Used to be, the therapist, a lot of times you need referrals too. Yep.
so has there been, with you being involved in the WASA area, has there been an increase in saying, okay, we have therapists in our high schools, what about getting chiropractors in our high schools?
Right. I would love to see that. I don't know that. I know in different parts of the country, I think that's what's happening. I think probably in the, central United States here, we're a little bit more conservative. And so I think we're maybe a little bit slower than whereas if you're perhaps out in California or on the East Coast, they're gonna be a little more progressive and you're gonna see those things happening already.
I was mentioning to Ron, as we were walking up and I was carrying the table there,
Yeah.
I think it was 2 years ago down at DC Everest regional or sectional track meet, one of the teams had tables. Obviously, they weren't realigning backs, but they were giving their teammates massages before they ran, which is a big thing as far as that active massage before they performed in that track. I think it was Rice.
Well, it's a lot, like I said, it's fantastic for athletes. And I work a lot with, there's a few physical therapists that I work with, and we do some physical therapy in our office because, the structures that attach the spinal column are, we have muscle that attaches. And physical therapists typically are going to deal with and address your issues with your muscles. Whereas chiropractors are going to deal with the alignment or misalignment of your spinal column and these vertebrae. But because they're interconnected, they go together. So if you can go to physical therapy and work a muscle, but if you don't correct the alignment, it's never going to completely heal. And vice versa. I can adjust a patient, but if I don't work on the soft tissue and the muscles that support the spine, it's going to keep going out of alignment. So that's why I utilize the physical therapy and soft tissue modalities in my office to help do both.
Does your office handle rehabilitation like you said you got to do on that?
Yes, yep. Some offices do only that. But yeah, I see some personal injury and workers' comp. Typically, it's my existing patients that are involved in an accident that come in. It's not that, yeah, not just a sole personal injury practice. But yes, we do that. Cool. I get done too early.
Any other questions?
No.
What's the biggest, or obviously you can't probably state it, but what's the biggest discrepancy you've ever seen in like a leg length? And how many, let's say, sort of,
Yeah.
Stella.
Hers was about a quarter of an inch, which wasn't much, I
So
think.
can you get it to the point where they're equal?
Yeah, so typically, that's a great question. So somebody like you, Tim, maybe not because of your past knee surgeries. So it depends if you have a functional or a structural short leg. So this pelvis obviously needs a
Plus, he's really old too. So.
Plus it's really
That's my
good.
pelvis right there.
Yeah, exactly. He's falling apart.
So, so this is your pelvis, base of your spine here. And then these are your legs, which have been chopped off. But when your pelvis is misaligned, one leg looks shorter or longer than the other, which is why when I'm doing that leg strip,